Hello, I'm Pam Martin, and I'm here to talk to you about type 2 diabetes and how to manage your diabetes. As you may know, diabetes can cause long-lasting problems throughout your body, but you can slow down or even prevent these problems if you keep your diabetes well controlled. One problem that can occur when you have diabetes is damage to the nerves throughout your body. This is called diabetic neuropathy and can affect different parts of the body, including your digestive system, hands, feet, and even sex organs. Neuropathy usually starts as tingling or pain, but over time can lead to numbness. This is especially dangerous because if you get a cut or blister, you may not feel it. If you don't feel it, you won't treat it, and it could get infected. Many people with diabetes and neuropathy also get foot ulcers. If you have an ulcer that won't heal, it can get very serious. So, it's important to pay close attention to your feet and check them regularly for sores, cuts, or blisters that could potentially turn into ulcers, especially if you are losing some feeling in your feet. There are some simple steps you can take to prevent foot ulcers. The first thing is to check your feet daily, including in between your toes. Look for any sores or other skin problems. You can use lotion on dry feet, but avoid putting it between your toes. Wash your feet daily and dry them well. When you trim your toenails, trim them straight across. Avoid being barefoot to prevent injuries you may not notice. Get plenty of exercise and ask your doctor to help you with an exercise plan. Wear shoes that fit well to avoid cuts or blisters. And have your feet checked out by a doctor. The most important thing you can do to prevent neuropathy and foot ulcers is to keep your blood glucose in a healthy range by eating healthy, staying active, and taking medicines as instructed by your doctor. Be sure to talk with your doctor if you're not sure what your blood glucose should be. Kidney disease is a common complication of diabetes. Over time, high blood glucose levels can damage the blood vessels in your kidneys, making them unable to do their job, which is to remove waste from the body. When waste builds up, this results in kidney disease. People with diabetes are more likely to develop kidney disease if they also have certain risk factors, such as high blood pressure, a family history of kidney disease, or uncontrolled blood glucose over time. One of the first symptoms you may notice with kidney disease is swelling. This happens when excess fluid builds up in your body. Other symptoms may be weakness, less interest in eating, poor sleep, and trouble concentrating. The best way to prevent kidney disease is to keep your blood glucose in a healthy range, but you must also keep your blood pressure at a healthy level. If you do start to develop kidney disease, there are some steps you can take to limit the damage and reduce your blood pressure. These include eating less salt, avoiding tobacco and alcohol, losing weight if you need to, exercising regularly, and managing your stress. Stress can also cause increases in blood glucose and blood pressure, so it's important to avoid or take steps to reduce stress. Talk with your doctor if you feel like your stress is unmanageable. It will be very important to give your best effort to make these lifestyle changes. When these aren't enough to control kidney disease, your doctor will likely talk with you about other options, such as medicines, a special low-protein, low-sodium diet, and possibly dialysis or even a kidney transplant. So let's review. The health problems that can come from diabetes can be very serious, but you can do a lot to prevent them or keep them from getting worse. Keep up your hard work in controlling your blood glucose and blood pressure with healthy eating and exercise. Remember to find ways to de-stress and go to all your doctor's appointments. They can help you take steps toward living a healthier lifestyle.